consumers are very used to getting everything they need with the touch of a button from their smartphone, so their healthcare is no different. So when you think about telemedicine from a patient's perspective, it's now the ability to interact with their doctors and other healthcare professionals right from their phones.
This is Horizons, stories about what's next in the world, powered by Compass Data Centers.
I can sit on my couch now and my doctor can treat me at home. You know, there's a lot more, in some ways, the concierge vibe of having someone available to you whenever you need them, having literally an urgent care in your pocket. Like we're kind of recreating that again, but just through technology. There is so much health tech enablement with your smartphone. It is it's limitless, right? So there are now ultrasound probes that can function off of your smartphone. I mean, not only is that an amazing technology, but when we talk about things like access to care, you know, and practicing healthcare in places where they might not be able to afford, you know, a $10,000, you know, or more ultrasound machine, there's now versions of these, you know, technologies that again require just a simple smartphone and are so much more affordable. There are EKG, you know, monitoring, or telemetry monitoring really that can hook up to your smartphone. And so, you know, being able to know about your heart rhythms on a regular basis obviously provides the doctor with so much more data, right? It's not just the snapshot in time when you go to the hospital and you get an EKG for those few seconds. You can now say, what does your heart rhythm look like for the last 2 weeks? And that's obviously more meaningful. You know, you can deduce more meaningful from the information because there's so many more inputs. On the other end, we tremendously value convenience in our society. So you could almost make the counter argument, which is, you just got something done for me in a fraction of the time, at a fraction of the cost. I didn't have to miss work. I didn't have to sit in your germ-infested waiting room. In theory, I should be motivated to pay more because that was such a better user experience. But I think you're right. Sometimes we say, well, that looked easier, so I shouldn't have to pay as much as I was paying back when it sucked. There are still approximately 19 million Americans who don't have access to high-speed internet. And so when we start talking about how to close the digital divide, part of that is building the infrastructure that's necessary to get them the tools they need so they can access telemedicine. So during COVID, for example, there were over $500 million in federal grants to build infrastructure, especially in rural communities where oftentimes that's where broadband is not found. Part of, again, addressing the digital divide though is it's providing patients with tools like on their terms. So even though we have these millions of Americans who don't have access to high-speed internet, we also have, we know that, for example, 86% of Medicaid, patients, they have a smartphone. So, I think it's about saying to ourselves, well, how do we get them access to care, even if it's through their phone and not necessarily through something that needs, broadband. We will start to see a shift in what patients consider to be normal to have at home. The modern day medicine cabinet is going to look very different than it did 20 years ago. Whereas before, no parent would have been in a house where there wasn't Tylenol and a thermometer in their medicine cabinet. Now they're not going to be found without their digital otoscope in case their kid is one of the 3 million ear infections this year. So I just think the tools that we're going to start to see as normal, as everyday, as commonplace, is going to have totally shifted away from, non-smart to smart, all tech-enabled. And, that part of that, again, will be this movement on all fronts of care into the home. So imagine if everyone was able to just kind of have standard operating procedure. You have your little emergency box in your house, and it has things like a defibrillator and, a few other tools that are used in the setting of common emergencies. And those tools are all telehealth enabled. So the information from those tools, they're user-friendly so that the prudent layperson can use them. And the information that's gathered from them is sent instantaneously to an expert, right? And take it even a step further, imagine your everyday cable provider is now a telehealth provider, is a telemedicine provider. And so you literally are just sitting there in your living room, take out of your emergency kit, put on your little, we'll call it like, power pack, and off the information goes, and up on your television screen pops the doctor who tells you to take an aspirin and to do X, Y, or Z. I 100% anticipate that we will have emergency care at home. And not to say it'll make the concept of EMS or pre-hospital care obsolete, but I think we will start to see a lot of that move into the home.